Gonococcal infection is a sexually transmitted infection caused by the gram-negative bacterium Neisseria gonorrhoeae. Clinical presentation. Some people with gonococcal infection may be asymptomatic, even though they can still transmit the infection. The most common symptoms in men are acute urethritis characterized by profuse mucopurulent urethral discharge, dysuria, and testicular discomfort. In women, mucopurulent vaginal discharge and dysuria are also present. Several women may have lower abdominal pain due to ascending infection, causing pelvic inflammatory disease. An infection of the upper female reproductive tract with inflammation of the uterine tubes, endometrium, or abscess formation. In both sexes, symptoms of acute proctitis with pain, pruritus, discharge, and bleeding of the rectum may occur. Pharyngitis, mostly manifesting as a mild sore throat, and conjunctivitis are other conditions that usually coexist with genital infection. Rarely, the infection can disseminate into gonococcal bacteremia, and this can typically lead to localized infection in one or more joints, known as gonococcal arthritis. In pregnant women, the infection can be transmitted to the newborn child during vaginal delivery. In newborns, gonococcal infection can present with acute ocular infection, also known as conjunctivitis or pharyngitis, manifesting just a few days after birth. Untreated conjunctivitis may lead to scarring and blindness of the newborn. Disseminated infection with septic arthritis, usually involving multiple joints, can also occur in newborns. In laboratory tests. Molecular testing has become the recommended gold standard technology to diagnose and screen populations for Neisseria gonorrhoeae. Neisseria gonorrhoeae can also be identified by light microscopy of gram-stained samples. A presumptive diagnosis can be made if intracellular gram-negative diplococci are observed in polymorphonuclear leukocytes in urethral discharge with male patients. But with women, gram stain of urethral samples has low yield. Instead, gram-stained smears from the cervix are considered positive if intracellular gram-negative diplococci are observed in polymorphonuclear leukocytes. Antibiotic treatment. When choosing antibiotic treatment, local resistance data should determine the choice of the most appropriate therapy. If data are not available, dual therapy should be given. If symptoms do not resolve within about 5 days of adequate antibiotic treatment, a resistant infection should be suspected, or an alternative diagnosis should be considered. Dual therapy for genital and anorectal infections or oropharyngeal infections. A single dose of ceftriaxone and azithromycin is the first choice. Alternatively, a single dose of cefixime and azithromycin could be considered as a second choice. Single therapy for genital and anorectal infections if local resistance data confirms susceptibility to the antibiotic. A single dose of cefixime or ceftriaxone or spectinomycin. While for the single therapy of oropharyngeal infections, a single dose of ceftriaxone is the only available treatment option. Gonococcal conjunctivitis in newborns is treated with a single dose of ceftriaxone, and the dose must be adjusted based on body weight. Erythromycin eye ointment could be applied to both eyes soon after birth as an ocular prophylaxis. Prevention. Sexual education, promoting consistent use of condoms, pre- and post-test counselling, interventions targeting high-risk groups, and sexual partners should be informed of the disease and treated.